Well, hello everyone. My name is Faith Smith. I'm 29 years old. I'm an undergraduate student at the University of Michigan studying biochemistry and psychology, and I'm diagnosed with vascular Ehlers-Danlos syndrome. My diagnosis story, begins in February of 2017, where I woke up abruptly with severe pain. I attributed that to severe gas pain as I do have IBS, and symptoms from that. A lot of mine are constipation with gas. But the pain persists and became more severe, where my mother and my brother finally convinced me, I think we should go to the emergency room. Once we arrived at the emergency room, we waited for a brief moment, and then we were taken to a room where I was prepped and prepared for tests. When those tests came back, I was hurriedly rushed to emergency surgery. During that time, they had found that I had a perforation in my sigmoid colon that has cascaded to a point where I had a pneumothorax in my lung and I had an infected and enlarged spleen. After surgery, the following day, I woke up in emergency. In the not emergency, but in intensive care unit, where I learned of these things, and I found out that I had an ileostomy. So my treatment from that on thereon lasted, I want to say about 3 months, where I had to healing, but also learning how to take care of my ileostomy as well. After therapy and time healing from that first perforation, I went on. 2018 was a great year. Had no more emergency complications, no more severe pain in my abdomen, and things were normal. Same February of 2019 came again, and I had the exact same episode where I was rushed to emergency again. From that point on, my medical team that I have developed because of the first emergency were rushed and hurried to try to figure out what was the cause of these perforations, as I had no prior history of any of the suspected causes. And every test that came back proves what our assumptions previous were wrong. I had a routine checkup with my gastroenterologist where he let me know that he had been doing some research and he figured that a cause could be either autoimmune issue or was a connective tissue issue, where I was then referred to a rheumatologist. After meeting with my current rheumatologist, she proceeded to do a physical examination and let me know that she suspected that I possibly had EDS, in particular, vascular form of EDS. She then referred me to a geneticist where she did the physical examination, and I found myself being qualified for genetic testing, where back in October of 2019, I received my formal diagnosis as testing positive for vascular Ehlers-Danlos syndrome. Since then, when it concerns pain management with my syndrome, a lot of our issues kind of stem around inflammation, in particular in my gastrointestinal region of my body. That's where all of my symptoms manifest mainly when it comes to severe pain. So our goal is to manage bowel movements without causing any stress onto the organs themselves, as they are severely fragile. There are certain pain medications that I'm not allowed to take. In particular, over-the-counter pain medications, such as NSAIDs, I have to avoid. So managing my pain in a simple way, as kind of more self-therapeutic, is what I kind of do now. So whether that's heat therapy, doing bath soaks to kind of help calm my overall self, because your emotions do affect the physical pain in your body. That has helped me greatly. During severe moments where I have to use muscle relaxers or narcotics, we try to use them in the least amount of dosages as possible, being that narcotics slow down your GI tract and we don't want things to get backed up, as that's a big issue as how fragile my intestines are. So with those, we have supplements like things like Miralax, which is an osmotic laxative that helps to move things smoothly and not so severely, to help with the pain during that time if I have to take narcotics. The other physical manifestations that someone with vascular Ehlers-Danlos syndrome has are the traditional symptoms of having loose joints. We're very bendy. Those are still symptoms that I manage. And those I manage with compressions. I love Epsom salt soaks. You have to do those at the end of the day. They help a lot. And warm heat therapy helps me greatly. And yeah, when it comes to my overall journey with EDS, I can't say I'm necessarily surprised, as these are symptoms that I've been dealing with since I was younger, just never had a name for it, never had anyone think to look into EDS as a possibility. But now that I have a diagnosis, even though it's a little later, I'm happy and I feel more free to actually be myself, as I fully know what's wrong. I always joke with my mom when I was younger, because we would go from doctor to doctor. I'm trying to figure out what was wrong. And a lot of times they will say, oh, well, it's just her anxiety. It's in her head. She's not really in that much pain. But knowing now, I wish I knew what I know now then. It would have helped me greatly emotionally as a young child. Growing up with many people, especially physicians, not believing me. But I would joke with my mom and I'll tell her, I said, Mom, it'll just be, with me at least, that it'll be something rare that I have. And eventually we'll figure it out. But I'm grateful to now knowing what's going on, and hopefully my story and what I've shared today could help you all with your patients and diagnosing and treating those that come into your presence in the future. Thank you for your time.